Amanda with Straightsmile Solutions, straightsmilesolutions.com, and let's talk a little bit more about extractions, be it premolar extractions versus lower incisor extractions, but specifically we're going to talk about class 2 extraction patterns. Now, if you've watched all my other videos, not only for Invisalign or for braces, you know I'm super anti extractions, but there's occasional times when you have to do it. It's a non-growing adult who has maybe periodontal disease, if they didn't want to extract their third molars, or perhaps they have a lot of restorative, like a lot of really nice crowns, and they don't want to IPR their crown. So there's definitely reasons that we need to do it. Occasionally it comes up, so you should really understand the class 2 extraction patterns. So number one thing I want you to keep in mind, so if we ran out of ideas, and let's just briefly refresh, if you go, I'll refresh your memory. Okay, I have a really good video on tackling crowding, and I'd really like you to listen to that video before you listen to this video. So if you go to my YouTube channel and you put in Straightsmile Solutions, it'll take you, to my YouTube channel. And then go to your YouTube channel, put in Straightsmile Solutions, takes you to my YouTube channel. Then there's a little keyword finder. It looks like a little magnifying glass. It's on the tabs at the top, but towards the right. Go to the little magnifying glass and put in crowding, and you're going to see a video that looks like a bunch of arrows and directions. Click on that one. There's 5 different ways you can resolve crowding. Before you can understand this, you have to understand the basics on the 5 different ways to resolve crowding in an orthodontic patient, and this is always my last resort. So if I run out of other options, then I'm going to go to this, right? Okay, so let's assume we ran out of all the other options. So we can't do IPR, we can't do sequential distalization, we can't do expansion, we can't do proclinations. Yeah, that's pretty much it. So what are we going to do now? We're going to take out teeth. It's a slightly class 2 patient, or it's a full class 2 patient. So let's talk about class 2 patients. So first of all, other thing I want you to do is I want you to check the midlines and check the bite on the sides. And I want you to be 110% sure that this patient does not have a CR-CO shift before you set up the treatment plan. Now, if this is a teenager, God, I hope you're not taking out premolars on a teenager, but if it was, okay, and you were thinking about doing expansion, you should definitely do your expansion first before you set your extraction pattern. Why? Because the bite often can change. There might be a shift. We're going to remove the compensations, and now that's going to change how many teeth and which teeth we're going to take out. So in those type of cases, I never pick the premolars to take out, or how many and where, until the expansion is done and settled. So that way I know the final bite. But same thing can happen in adults. Sometimes you're going to want to do some initial alignment first. Okay, obviously if we're taking out teeth, we don't want to flare, but maybe you want to remove the compensations first, okay? Or at least make sure you get the patient in CR before you decide which teeth you're going to take out. Okay, I'm assuming you know this is the final bite. Now let's talk about different types of class 2. We've got full step class 2, and I don't necessarily have the best examples of this in my photos, so you need to kind of listen to my verbal. Full step class 2, okay, is going to be when it's a full step, like the canine on the side. The canine is like in full class 2. It's not like cusp to cusp class 2. It's full class 2. It's a full cusp class 2. It's not half step class 2. Okay. So if you don't understand the difference between full step class 2 and half step class 2, you need to go back and check that out and understand that. Okay. So full step class 2 means that they're going to have an overjet once you remove, crowding and stuff like that of good, 6, 7, 8, 9, 10 millimeters. I mean, big class 2. Obviously, you need to have a Ceph, because a Ceph is going to tell you what you need to do. But a full step class 2 normally is going to be just upper 4's extraction pattern. Okay? Full step class 2. Now, if it was full step-ish class 2 and a lot of lower anterior crowding and some perio, I might take out upper 4's lower incisor. Okay? If it's full step class 2 with nicely aligned lower incisors, I'm going to just take out upper 4's. So that's my full step class 2 extraction patterns, either upper 4's or upper 4's lower incisor, depending on perio and how the lower incisors look and how class 2 it is. Okay, the other premolar extraction pattern, this would be for half step class 2. That means somewhere between the neighborhood between 2, 3, and 4 millimeters of class 2, not full cusp class 2. Then that's going to be upper 4's lower 5's. Okay. Now, There's a few derivations of this. Let's say patient had upper 5's were bombed out or had root canals and crappy crowns, and we really want to take out all 5's. We can totally do that. That's fine. I mean, I'd rather take out the bad teeth than the good teeth, even if it means it's going to be a more difficult biomechanical movement, or we're going to need more anchorage. Then I'm just going to put supplemental anchorage in on the top, like a Nance or a TPA to hold my force back. Yes, you can use TADs, but I don't see the point of using TADs if why do something surgical that's painful and expensive if you don't need to, because you don't need to. Okay. So that would be that extraction pattern, and vice versa. You could do that on the lower with a lingual arch if you needed to take out something different. Okay, like if you needed to take out lower 4's instead of lower 5's. All right, so that is pretty much it. Those are our various 3 different types of class 2 extraction patterns. Remember, remove decompensations first, put the patient in CR before you decide, and as needed to, if it's a teenager, you need to do your expansion first and reevaluate exactly how the bite is. Don't rush into it. You can always do some initial level align first before you go ahead and shuck teeth. All right, thanks so much, and see my other videos on how to close the space once you take the teeth out. There's one called Class 2 Extraction Beads on a String. Watch that one. All right, thank you.